Good.
I definitely have not felt anything like that before.
Okay, tell me about your neck pain.
So it usually is associated with my migraines. I can feel it pre-migraine, and it feels like there's a golf ball back of my neck, right where the skull and the neck kind of meet.
Okay, how far back can you remember having migraines?
Very first migraine I can remember was around 7. It was all of a sudden, didn't have another one till about the age of 12, and then they became consistent around the age of 19.
Okay. Do they run in your family?
My mother had them around some point, but they were only lasting a couple of years and then they stopped.
Did you have any trauma as a kid? Any physical trauma?
Oh yeah. Yeah, definitely a rough kid.
Anything in particular that you can recall?
I was on a tire swing and the rope broke. I was on my stomach and my face hit a uprooted tree.
Right. How old were you when that happened?
Gosh, probably around the same age as the first migraine. Couldn't tell if it was before or after.
Okay. Did you have any birth trauma? Or when you were born, do you know how you were born?
Quickly.
Okay.
Almost in the car, but that's about it.
Okay, that's usually not associated with trauma.
But
does the neck pain always start before the migraine or no?
Yes. Yeah, that's one of the precursors.
Okay, how often do you have an episode?
They used to be 15 a month until I started Botox treatment. And then since I've been on a regimen of that for the past 2 years, it's helped.
Have they pinpointed what muscles in the Botox treatments? Do you know?
I pinpointed it myself just by telling them where to put it and when.
Yeah.
And in the back of the neck and in the temple area is usually where it helps the most.
Okay. All right, do you have any other issues? Do you have any ankle, knee stuff?
Yes, definitely. I've fractured both of my ankles previously. I've always had loose joints, so to speak. I roll my ankles and sprain them easily.
Okay.
And I also have the ligament tear. I can never remember which one.
Your ankle or your knee?
It runs from the ankle to the knee. It starts
okay.
here and then goes behind.
Okay.
Shoulders, bursitis, and tendonitis.
Both sides?
Mm-hmm. The left is worse than the right. But yes, I've had the with and without contrast MRIs on both tendonitis.
So tendonitis, loose joints. Have you ever been tested for any joint hypermobility? Ehlers-Danlos syndrome?
No, not familiar with it.
Can you do this one where you touch your thumb to your forearm?
Yes.
Okay.
I didn't realize I could do that.
Mm-hmm.
Yeah.
All right, so there may be some insight there into why you get migraines. When you have a migraine and there's always that aura of the neck pain first, then often those are musculoskeletal induced migraines. So, but it sounds like there's a possibility for a combination of migraines. When you have elasticity of your joints, when you have hypermobility in your joints, that elasticity is sometimes in other connective tissue as well, like your arteries and veins. And so sometimes that elasticity inside of an artery or a vein could also contribute to migraines. We'll know after I adjust you. We'll know after and see how much this helps you. That's good. And then at the end of that breath, we're going to give a little push like this, okay?
Sounds good.
Okay, good. It's already started to move. All right, let's give that a try. Go and take a deep breath in. Out. Good. Shoulders relaxing. Good. Oh my God. How's that?
That was very nice.
Good and out. There we go. Good. Let this relax here. Good. Let it go. Let it go. Very nice. Almost there. All right, we're going to bend the top like this. Good. I'm going to bring it forward here to build up lat. And we'll pull this arm out like this. Good. Good. We're going to bring this down. Shoulders relaxed. Good. Down. Sinking in. Good. One more time. Let it go. Good. Gentle, gentle, gentle. Bring her back. How's that?
That was nice.
Okay, so now we're going to adjust the lumbar spine. Good. Same thing. Your shoulders are stretching in this way. Then we're going to come into the lumbar like here. Gentle, gentle, gentle. There's more. Hold on. Good. Hang back. Ah, man. How's that?
nice. I could tell it wasn't need. I could just, like a domino effect, feel it right down.
Okay, now let's see. Go ahead and turn your head to the right. I knew it. Okay, back to center. Okay, now turn your head to the left. Back to center. You lefty?
I'm right. Sometimes lefty.
What does that mean?
I can write with my left hand, just not as well as my right. So I am right dominant, but I did try to train my left arm to do the same thing.
Okay.
Just out of curiosity, if I could.
Okay, let's do this now. Bring your right ear down to your shoulder. Yeah, back to center. Okay, nice and gentle breathing. Good. We're gonna bring your head over to the side. Following your breath, we're just gonna follow just like this, and then we're gonna push it. Good. You're perfect right now. You're nice and relaxed. Good breathing and sinking in. Good. Shoulders. Good. Good, right there.
That was a nice one.
Back at the top of the spine to correct the rotation now. So we're just going to bring your head over to the side like this and then very gently come up like that, okay?
Okay.
Let me test the bottom of the spine too, actually. 7. Oh, that feels like it needs a 2. Okay, we're going to do 2 adjustments. First, here like this, gentle, gentle. Good. Good. Now at the bottom of the spine. And bring this guy over. Good. How's that?
I definitely have not felt anything like that before.
Nice and gentle. Okay, I'm going to adjust your ankles now. We're going to pull down in this direction like that, okay? One more time. In between your knees here.
Okay.
Hold on. Okay, squeeze. Hard as you can.
That's good.
This one's a tad more aggressive than the other ones, okay? Nice and gentle breathing. Go ahead and take a deep breath in and out. Sinking in shoulders and hips. Good, let's follow the next breath out. Just really sinking in. Letting the head and shoulders, neck. Good, letting it all go.
That was a lot. It was good though. I think parts of my spine adjusted that I haven't adjusted in a good 10 years.
Yeah.
That was deep. That was deep.
I feel much more balanced. Didn't realize how unbalanced I was until the shoulders feel a lot better. Sitting at a desk all day definitely causes a lot of tension. It's very nice. I feel like there's less effort to stand straight.
Nice.
A lot less effort. I feel much straighter. Much straighter. Sometimes you don't know how badly you need something until...
This is an Ayurvedic pulse reading. So in traditional Western medicine, I shouldn't say traditional, in Western medicine, they just use a single point And they're measuring rate, rhythm, contour, and amplitude. It's all a measurement of the cardiovascular system. In Ayurvedic medicine and also traditional Chinese medicine, there's a 3-point pulse reading. There's a superficial and a deep layer. And each point is associated with an organ system, and meridian. In the traditional Chinese medicine, it's the large intestine, the stomach, and the adrenal gland, thyroid, and then on the deeper layer, it's the lung and the spleen and the organs of reproduction. So let's start off on the superficial layer. Okay, not feeling too much here with the colon, that's good. No digestive issues, right?
No.
Stomach feels good. Adrenal gland, thyroid, it's just, it maybe could catch up with the other pulses a little bit. Do you drink coffee?
I do.
Try drinking it later in the day. When do you drink it? Do you drink it
Usually earlier in the day, and I cut it off middle day.
How much do you drink?
Usually no more than 16 ounces.
Do you count? Does that count in your water?
Oh no, that's separate. Like 16, maybe 24 ounces. Like because I have a 8-ounce cup.
I would try, like, just delaying it a couple of hours. You want to be up and moving around, and then like maybe a little bit, like an hour before lunch. Do you eat lunch?
I have been getting better at that. Usually didn't, but...
Do you get tired after lunch? Calorie crash?
I do, usually.
Okay. Just from what I'm reading from your pulse, I feel like you would conserve and have more energy if you waited till the afternoon to drink the coffee. Unless you don't want to drink 24 ounces of coffee in the afternoon, but like just the 1 cup after lunch. All right, I'm gonna push down to the deeper layer. The spleen meridian is interesting. It's an interesting signature. Have you ever had any tests, blood tests?
I've had
Have you been diagnosed with anemia?
No, low calcium. It was 5 points lower than it should have been, but that's it. I had a full panel done where they tested good cholesterol, bad cholesterol, calcium, everything.
Why did they test it?
I asked them to.
Okay, good. Lung is good. No asthma.
Nope. It does run in the family, but I don't have it.
Oh, okay, now. Reproductive system pulse. Are you on birth control?
Yes.
It's hard to distinguish. Do you cycle anymore?
Yeah. Yep.
So it probably keeps it regular, 28 days. Are you coming up to your cycle now? Are you about to have it?
I am.
Okay, left side. Superficial layer, it goes small intestine, gallbladder, urinary bladder. Urinary bladder, it's just maybe a slight weakness there. Hold on, let's make sure. Okay, I'm okay with that. No urinary tract infections?
Nope.
Okay, no gallbladder issues.
Not that I know of.
Okay, very good. Okay, down to the deeper layer. Kidney, lung, heart. This side is different than the other side, the left side. Very steady, very consistent. Okay, I'm going to do one more. And this one I push all the way down and then come back up a little bit. This is the sixth. In one system, there's actually not just 2 layers. There's 7 layers. So 1, 2, 3, 4, 5, 6, 7. And although I'm not skilled or practiced enough to determine the information of all those layers, the first and the last layer, superficial and deep, and the 6th layer. The 6th layer is a reading of the energy body. Are you familiar with the chakras? Do you know what they are?
I am.
Okay. Is it okay for me to read your chakras?
Sure.
Okay. One more time. Very root chakra, sacral chakra. I can't distinguish. It's almost like it's in between the first and second chakra. You haven't moved recently, right?
It's been over a year.
Okay. Okay, so the signature of this is very feminine related. It's possible. Did you have a rough childhood?
Yes.
Did you get along with your mother?
No.
Sorry.
That's okay. I had a great relationship with my father.
Do you still talk to your mom?
I do not.
Is she alive?
She is.
Okay, well, what it feels like, this is actually with that shoulder stuff. Whatever responsibility, whatever you feel like is not your fault. You already know that consciously. But like unconsciously, you have to like really sink deep down. Man, it's rough. It's a continual practice. It's never perfect. You have to continually let go, moment after moment. Anytime anything ever comes up that reminds you, anytime you're ever in a situation where you want to go back into the past, you just have to let it go every single time, every chance you get. I know you're already practicing it. You've come a long way. You definitely have your shit together. You're doing great.
her too. It's a very interesting relationship.
Okay, good. So here's our post chat because
Yes.
now I've determined that you've worked on this relationship with your mother a lot and you're actually more comfortable. But you just told me this amazing story. So we were getting down to details. I asked you your name. All right, can you say your name?
Yeah, so I like to go by Elizabeth, but Elizabeth is my middle name. My first name is Carrie.
Mm-hmm.
I was named after the Stephen King book, which was my mother's idea. And for my generation, the movie was pretty popular, so of course, spellings matched up. I got bullied a lot for the spelling. Came home one day to my mother.
Which was another thing that it was disgruntled between you and your mom.
So I asked her, where did my name come from? And she did indeed say it was from the Stephen King book. I was like, oh, okay, so you did this to me.
Mm-hmm.
Right at the height of the bullying, of course. So that's pretty much when I decided I was going to go by my middle name, Elizabeth, which was after her mother, my grandmother.
Is that why you have the butterfly on your back?
The butterfly, that is actually a form of rebellion. My dad chose that. I was 15, and he knew I was going to go get it. He couldn't stop me.
Mm-hmm.
So he just wanted to stop me from getting anything too much before I was old enough to really think about what I was doing instead of being impulsive. So he chose the butterfly.
And how also do you get a tattoo at 15? Tell me.
Not legally.
Okay.
Not legally.
Okay, shout out to the illegal tattoo artists out there.
Shout out to Crater, wherever you are, Crater.
All right, so, and then and I actually said I have never really been inclined to watch scary movies, and so I didn't know anything about Carrie, but then you told me this fascinating thing.
Yeah, so in the book, in the movie, Carrie, the very first one, her and her mother did not have a great relationship. Her mother was, long story short, abusive.
Okay. Yeah, okay, thank you.
You're welcome. I think that's about it. I don't like my first name, and I got a tattoo way too young.
Okay.
Thought it was so cool.
Yeah, of course that's not it for you. Okay, but I'm sure there's multiple layers.
Oh, yeah.
And because all of us have deeper and more profound aspects of ourselves that we can, if we choose, come in contact with those. But what I was going to say was it was a really nice like holographic resonance of just like, okay, Carrie, okay, you reiterated, you validated again, okay, my mom gave me that, I didn't like the name, I didn't like my mom, but then it was like a hologram. In a holograph, you can take out one little piece of it and you can blow it up and you see the entire thing, you know what I mean? And so sometimes we can find that same pattern recognition in life, and so in this case it was a movie which was holographically resonating with the appearance of your life.
Absolutely.